On-the-scene coverage of ACC 2015 is supported by Effient.
I'm Peter Block here in San Diego at ACC 2015 for On the Scene. With me is Hans Thurgod, difficult last name to say, and I'm going to call him Hans. Hans has just reported on the Nordic TAVR trial, transcatheter aortic valve replacement, using the CoreValve Medtronic valve replacement. So Hans, briefly tell me about the trial, and then let's get into what we learned. We know a lot about TAVR already, so tell me what's new.
The new in this trial is that this is the first randomized trial to include an all-comers population, primarily low-risk patients.
So it's a low-risk trial, STS scores of?
STS score is mean around 3, and 80% of all patients had an STS score below 4. So truly a low-risk patient.
Okay, so this is really a step toward the lower part of the STS curve,
Yeah.
And that's something new for sure. So give me the outcomes.
So the primary outcome, which was a composite rate of death from any cause, stroke or myocardial infarction, was not statistically significant different between the two groups. The surgical group had a rate around 16% and the transcatheter group around 13%. But the trend for all the components in the composite outcome was that the rate was lower for the transcatheter group.
Yeah, I noticed that when I was looking over the slides as well, that the trends are all in favor of TAVR.
Yes.
There were a couple of uncomfortable outcomes, the need for pacemakers and the amount of paravalvular leak. Give me a comment on that.
Yeah, the rates are comparable to some other studies using the self-expanding prosthesis, the CoreValve. But at the time of designing this trial, which was in 2009, and when we did most of the procedures, we did not use the CT scans for annular measurements in all patients, and we used echo, and that could have made the sizing of the valves wrong, meaning that we undersized probably some of the patients, leading to more paravalvular leakage. Also, at that time, we weren't that, we didn't know that implanting the valve too low could lead to conduction abnormalities leading to pacemaker. So that's probably the reason why we had a fairly high rate of pacemaker implantation. But both of those things we have changed in our practice. So now we use CT scans for all annular measurements, and we use and we are very we try not to implant the valves too low, and that has resulted in a much lower, around 15% pacemaker rate currently.
So there you have a new trial using transcatheter aortic valve replacement against surgery. Good news, low-risk patients, TAVR does better. Bad news, high pacemaker rate, a little more paravalvular leak than you'd like, but probably technical issues to account for that. Thank you very much, Hans.
Thank you for having me.